Greetings to you. Good morning, good afternoon, and good evening, depending which side of the Greenwich Meridian you are at. And so today we are continuing with our discussion on the use of medication. And today we are specifically talking about completing the course of the antibiotics. And last time we shared about the antibiotics and we said these are the drugs, or rather the medication that are used to treat the illnesses, or rather the diseases that are caused by the microorganisms called bacteria. And so today, talking about that, we can highlight some of the sites where this bacteria can be localized and cause the disease. Like for example, we can have the skin infections like the cellulitis. Cellulitis is a bacterial infection that affects the deeper layers of the skin, and it is caused by the Staphylococcus bacteria, whereby you present with some swelling and some redness on the skin and so on. And we can also have some skin infection like the impetigo. The impetigo is also a Staphylococcus infection, Staphylococcus bacteria infection, whereby you present with some sores and blisters on the skin, on the surface of the face, the hands, and even the neck, or rather in the nose. Those are what we call the impetigo. And we also have some other skin infection like the boils. These present with the bumps that is filled with pus around the hair follicles on the skin. And then we also have some other parts of the body that are affected by the bacteria, thus having the bacterial infections or diseases. We have these parts like the respiratory system, where we can have the bacterial pneumoniae, you can have tuberculosis, even the pertussis, what we normally call the whooping cough. These are the respiratory infections that are caused by the bacteria. And some other parts like the urinary system, we can have the infections in the urinary bladder and the kidneys. These are also bacterial infections. And you can also have some other sexually transmitted diseases that are caused by the bacteria, like the syphilis, gonorrhea, chlamydia, and so on, and other infections from to other parts of the body. We have in the middle ear, we have the infections like the otitis media. In the meninges, we have the meningitis. We have even the food poisoning that is caused by the salmonella bacteria, or E. coli, or rather we call Escherichia coli, and many other parts of the body, including even the other parts of the body. And so today we are talking about completing the course of the antibiotics, which is very, very important. Once you have been given antibiotics, probably let's say like for 5 days, you're supposed to complete that dose. You're supposed to complete that course so that you may have this bacteria completely eliminated, or rather wiped out, or reducing its multiplication. Because once the bacteria multiplies, it continues to stay in the body, continue to cause infections, or rather the diseases, and the reason as to why you are not supposed to stop medication unless you've been advised by the doctor. The only reason that can make you stop the medication is when the doctor identifies that you have some allergies to this particular medication, or rather some intolerance, or rather the bacteria that has been identified in your body is not responding to this particular antibiotic. That's the only point where you can stop the antibiotics and probably be prescribed with more effective antibiotics. But you're supposed to comply and listen to the instructions at the pharmacy. Probably you've gone to that particular pharmacy with a prescription and medications have been given to you. Comply with the instructions that are out on the label and those other auxiliary instructions that you are given. For instance, probably you're going to the pharmacy, you have been given something like this. This one is called Zinat, 500 milligrams. This is an antibiotic that has cefuroxis that is used to eliminate the bacteria that causes illnesses or diseases, or rather the infections in the body. And so you are supposed to comply and complete the 5 5-day course. Now, for instance, this one, and sometimes you are even prescribed for 5 days, for 7 days or so. So you are supposed to comply by completing that course, the antibiotic. The reason of completing the dose, or rather the course of antibiotic, is so that you may be able to completely eradicate the bacteria that is causing the illness in your body. Because if you stop the medication, maybe let's say you took the medications for 2 days and you felt better, then you stop at that point. Do you know that this bacteria is actively multiplying, or rather reproducing in your body? And when it does so, the infections stay, right? The infections stay. And the reason that's why you have to complete is so that you may completely eradicate and weaken the multiplication of this particular bacteria that is causing the illness or the disease. And so today, that's what I wanted to share with you. Comply with the medication instruction. Complete the 5-day course, 7-day course, or so on, so that you may have this bacteria completely wiped out, eliminated, eradicated, or weakened. Okay? So that's what I wanted to share with you today. And you have some questions on the same, you can kindly DM me so that we may have a conversation on the same. But that prescription, when you take it to the pharmacy, listen to the instructions, comply with what you are being told about, complete the course of the medication, unless otherwise. For instance, if you have allergies or you are intolerant to some of this medication, it's only the doctor that can advise whether you have to stop this medication and maybe have other medications prescribed for you so that you may get better. But that is the topic for today, completing the course of the antibiotics that you have been prescribed for by the prescriber, medical practitioner. But also to us, the medical practitioners, we are supposed to emphasize on the need of completing the course of the antibiotics so that it may be easy for the patient, so that they may be able to understand the reason behind completing the course of the antibiotic. That's enough for today. Until another time, we will continue to share about this. This is a discussion that is healthy to the society and to all of us, the consumers, the medical practitioners, and the society at large. Right here from Gut Height Pharmacy, Nakuru. God bless you.